Hi, Dr. Peter Petropoulos from Potomac Medical Aesthetics. I want to talk to you today about the P shot, or it's also known as the Priapus shot. So, we look to treat men with the P shot who have issues of erectile dysfunction, particularly men who may not be having the type of function that they had in the past. Or we also treat conditions such as Peyronie's disease with the P shot, which is a bending in the body of the penis. So some of the things that may have been tried before that may not be giving the type of effect or not the full amount of effect that people are looking for, things like Viagra, Cialis, trimix injections, pumps, hormone replacement, or herbal supplements. You may have tried them, maybe they've worked a little bit, but maybe they haven't worked at all. So those are the type of patients that may be benefited by the P shot. So how do we do a P shot? Well, what we do is using a local anesthetic, we draw your blood, and then we spin it down the centrifuge to get the PRP, or the platelet-rich plasma, which has the blood-derived growth factors to rejuvenate penile tissue. So once we get the plasma, we inject it into the strategic points on the penis that will give the effects of the P shot. And we use the same technique that was created by Dr. Runnels. I've been trained by Dr. Runnels, and I follow his technique to get the best effect. So the P shot is really good for patients that are looking for improvement in moderate to mild erectile dysfunction, or to give them added benefit over their existing therapy, so that maybe if they're on Viagra or Cialis, they may be able to come off it or reduce their dose, or to get more effect from their injections or any other therapies that they might be using. Typically, it's not a cure for any disease, but it can be a very great improvement for many men with erectile dysfunction, where it will help in the existing treatments. So we don't think it's going to be very beneficial in patients who have severe disease like severe diabetes, or those who have spinal cord injury or any sort of nerve injury after a prostatectomy, where the P shot is unlikely to have any effect, or if there are other severe health issues that may be affecting erectile function. The results are not instant. It usually takes about 2 to 3 weeks to see any results. Usually at around 2 to 3 months we see maximal results, but they last for about a year or two. And if it does work, as it does in 80 to 90% of patients, it may get repeated in 1 to 2 years. So typically the results are a stronger erection, more fullness in the penis, and if you have any bending and we're treating you for that, for Peyronie's disease, you'll see an improvement in the straightening of the penis. So if these are some of the concerns that you have, we'd love to have you give us a call to see if we can help you out with the P shot. Thanks for checking it out. Hope to see you soon. Thanks.